All right, rest of this video, I'm just going to be pointing out a few things. So sit back, relax. It's going to take me a little bit of time to get through this, but it's going to be good information. Let's get started. So this is one of the people, Leslie Sarabro. Hi everyone, our daughter is 10 and was diagnosed with osteosarcoma in left humerus. Humerus is shoulder. December 18, 2019, so like 2 years ago. No lung mets have found on any CT so far. We completed standard MAP. So this is what's known as the most common and like route to go for treatment. MAP is a type of chemotherapy and had successful LSS in March. This is a treatment that you do after MAP. So I haven't even looked what LSS is, but if you go to my notes, you'll see that starts with MAP and then people do LSS after MAP chemotherapy. Okay, where was I? Okay, the path report showed clear margins and no something invasion and only necrosis. So this is something that after I think you do MAP, like these kind of numbers, and based on that it's going to depend on this for your treatment after MAP. Okay. And then he's saying, has anybody switched to MAP-E versus MAP? So this is something that comes up, and that's basically like something to look into. Starts with MAP, that's the most common, but look into MAP-E. Okay. Our doctor is recommending we stick to MAP, which is the standard. Okay. So in Bumrungrad, they have to have MAP chemotherapy, which I'm sure they do, because this is standard. And just curious out their experiences. Okay, so I'm going to pause and find some of the comments that applies to us. So mostly it's positive. They're talking about, I have less than 10% necrosis. This is after you do MAP, and did no treatment after. So they mainly did MAP. And I have good margins, which I think it means like they're not close to getting any kind of it's completely gone basically. 3 years NED. NED means that they are free. They're like in remission, meaning they are free of cancer. I was very anxious at the time, comforting, and then even if she had poor necrosis patients, survival rate is higher with MAP than without. So they're saying MAP is really good. Okay. Daughter went through. MAP was recommended for her son as well. My son is NED for 5 months now, so he's free of cancer as well with just MAP. Okay. This is the admin of the group, so she's very smart. You've gotten good advice here already. I can only add that I would encourage you to look at impact. Okay, so that's a new one, right? And I'll type in this. All right, so the admin is saying that's what's important. It's free to use in the US, throughout the rest of the developed world. Okay, pretty local. So it does improve survival. Okay, so it improves the success of the whole thing, right? So we need to look at that. You need to have the doc be willing to do the paperwork, blah, blah, blah. Okay, then he recommends some doctors and stuff like that. And my daughter had only 20% necrosis, but we did stick with MAP till the end, and we are glad that we did. We have had no new growth. So people have good experience with just MAP chemotherapy. Let's go to another person. Good morning. My daughter is 3.5 years of treatment, no recurrences. She's graduating college in May and having a total shoulder replacement in June. Okay. So would like to get the vaccine soon for her with Moderna vaccine. Has anyone seen a teen and young adult age group for reactions for vaccine. So they were afraid that if she has this kind of sarcoma, if she gets the vaccine, if it's going to be a problem or something like that. So it doesn't really apply to us. Someone's already vaccinated, but it's good to once again know that 3.5 years off treatment and no recurrences. So successfully free of cancer. Okay. Third one, I'm also talking to somebody about someone. This is just so we have a perspective. Osteosarcoma warriors, both 1 year post chemotherapy, we are so grateful that we made the decision to amputate because we are free from pain and living our lives happily again. So you can see they are fine. And this is last resort, right? We are not going to have to do amputation. This is absolute last resort, but we have to remember that if it comes down to it, statistics show that people who get an amputation within 5 years are just as happy as people who don't have amputation. So we shouldn't be looking at this as like, oh my God, the deal is done. And also, like, there's pretty good amount of robotics being done for extra limb. Like, it's getting a lot better. I'm not talking about in the future, it's going to get better. I'm talking about right now as available. There's already very good performance from some robotics. In fact, there are already rumors that some people with these performance enhancements are not going to be eligible to do sports because they have an unfair advantage. So the whole idea with like limb amputation, the fear, we can kind of pretty much drop it. The main thing to have our focus on is how to stop it from spreading to like other parts of the body, the torso. That is the number one. I'm actually personally, after reading a lot, I'm not scared of amputation as much. By the way, these are just a few posts. I went through at least like 30-50 posts thoroughly to pick just 4 or 5 for this video. And then I'm going to give you guys a few groups that you can look in yourself. Okay. My daughter is suspected to have, osteosarcoma. We go for a biopsy this Thursday. Very similar to us, okay? They do suspect is not good. Luckily, she is in no pain. So that's a little bad because someone is in pain. I wanted to find the group because all of this is new to me and I'm really nervous about everything. So look, his daughter, she's like 5 years old. She's very young. And she just got this. So, I didn't really go through these comments. I'm going to go through this, but just like overall, I'm going to have to wait until this guy finds out what he's going to do. So this is the last thing I'm going to look at for this little video, is that this is a statistics report, right? So it's by the admin of the group and factors which correlate with poor outcome. This is a historical in the last 30 years of people who has osteosarcoma. What are certain things that make the outcome a lot worse? So there's overriding factor which correlates. Historically, there's one overriding factor which correlates with poor outcome more than any other osteosarcoma, and that is having metastasis versus at diagnosis. So this, we're very thankful that we don't have this. This is the number one critical thing. If you have osteosarcoma with metastasis, however you pronounce that, it is far more dangerous. But if you don't have that, then it's not as dangerous. Currently, there was no nothing included in his reports of this happening. So we're good. It's like the chances are in our side, basically, for all the success, for everything. Okay, so what factors are known to correlate with poor outcomes? Okay, when reading this post, please bear in mind that this is not a direct it doesn't mean like if the statistics are not in your favor that you're definitely going to be the worst outcome. It's just kind of like a disclaimer type thing. Okay, second of all, information is based on 30-35 years of research known for osteosarcoma with demonstrated efficacy. That is okay. So look at this. Okay. Second of all, this information has been based on historical data of 30 to 35 years, during which there has only been one known treatment for osteosarcoma with any demonstrated efficacy, and that is MAP chemotherapy. So MAP is the #1 type of treatment as of right now, from what we know. I mean, I spent like about 2-3 hours, so it's not like a lot, but based on what we know so far, MAP chemotherapy is the best treatment approach, at least initially, to get into this. Okay? While MAP is still only standard care for osteo, we're hoping and trying to change this through research and clinical trials. Okay, so this is one of the things I'm going to be looking into heavily over the next couple of days is clinical trials. Clinical trials means they have not getting FDA approved, but they're in the trial phase, right? They're trying it out. So patient has to consent that, hey, if something happens to me, these people are not reliable, right? And this is where the new shit is, basically. The new results, the new data, science, and all the stuff is in clinical trials. So I'm going to be looking into some of this stuff with whether it be like ARC Invest's like biology department and stuff. They actually produce all their results publicly and email it to us. So it's pretty thorough. I'm going to be going through that. But anyways, I'll make a separate video about that. But anyways, to just go into this last part. With all that said, based on historical data, there are a number of factors which correlate to poor outcomes. These factors include, we're just going to look at the top ones, right? Because that's like what's mainly makes a difference, right? Like, okay, metastasis at diagnosis. This is by far the strongest correlation. The data seems to indicate that a bone mets with a worse outcome, with lung mets, however, data in some more sparse, etc. Like basically, if you have this, I think this means like it's like a different type of like marrow or something like that in the bone. I'll have to look into it, but we don't have this, so we're good. Next thing, is it axial primary tumors? Tumors not in long bones is more dangerous. So if the tumor is not in long bones, like, i.e. it's not in the arm or leg, have significantly worse outcome. So understand that. If it's in your arm, with the long arm, or your big bone in your leg, it's not as dangerous. But if it is in other parts of the body, it is much more dangerous. So he says pelvic is very dangerous, spinal, cranial, that's in the head, mandibular, I don't know what that is, rib, and etc. locations. The poor outcomes are part due to difficulty in surgically tumors. Like if you have in your pelvis or hip, it's very hard to do surgery, right? Like in arm, if worst case scenario, you can take off the arm, but if you have it in your like your chest or something, you can't remove a chest. So that's what it basically goes to show that. So overall, what I want to do this video is just kind of introduce what are the best approach right now, as we're heading to Bangungard, and statistically that we are on the right side. We are right side statistically. So we have to stick to the facts, not sugarcoat anything, not make up stuff and Google search and get too scared and go like ballistic. We stop researching on Google and stuff and just look at facts and only look at people who are already facing this situation, and then we can go from there on how to deal with it. Last thing I'm going to say is basically what you have to do is just type in osteosarcoma. Okay. These are groups. You can also type in group. Okay, and then you have to click join. We fight all this. It's like 200 members. It's very small. 5,000, 1,200. These are good. Just get in the big ones. I'll just get in this one right now. I'll do an example. Okay, looks like it didn't have any questions, but normally it'll have like question and answers, and then they will, let you in. Just fill it out. All right, that's it.